Hi, everyone. Welcome to the session on the Male Engagement Policy Framework. My name is Beth Rotak. I'm a gender advisor with Palladium, and I'll be your facilitator today, along with my two colleagues, Erin DeGraw from Plan International and Stephanie Perlson from PRB. So during this session, we'll talk about why we developed the Male Engagement Policy Framework, what it is and how it was applied, and what were the results. We're going to deliver a short presentation, and then we'll have about 5 minutes for questions and discussion. So I'll hand it over to Stephanie to start us off.
Welcome to this session. I'd like to start off first by asking you a question. We'll take responses in chat. When you hear male engagement in family planning, what do you think of? I want to start by explaining why male engagement in family planning is so critical to ensuring everyone's sexual and reproductive health and rights. Men and adolescent boys have an important role to play in family planning, both to meet their own reproductive health needs and to support and facilitate their partner's access and use of family planning. As you may know, Sustainable Development Goal 5 is gender equality, and within Goal 5 is Target 5.6.1, the proportion of women and girls who make their own informed decisions on reproductive health. According to data from 51 countries, only 57% of women aged 15 to 49 who are married or in a union make their own decisions about sexual relations and the use of contraceptives and reproductive health services. We know that gender inequality faced by women and girls puts their sexual and reproductive health and overall health and well-being at risk and hinders their livelihood opportunities. They often face greater barriers than men and boys to accessing family planning and health information and services. Patriarchal discriminatory norms prevent women and adolescent girls from exercising agency in their lives, and thus the importance of male engagement so that they can be allies as women and girls seek family planning and reproductive health. Men's and boys' reproductive health might also face harm since they could decide not to access health care altogether or partake in unhealthy behaviors because of patriarchal and gender norms, strict gender norms. Because of the potential for their strong influence on women's use of family planning, it is critical that men and boys partake in learning and dialogue about family planning and reproductive health and adopt new behaviors in line with this learning that uphold women's and girls' agency. Known as male engagement, men and boys can help uphold women's and girls' agency and ability to protect their family planning reproductive health by being clients, supportive partners, and agents of change. It's a way to start changing some of those strict gender norms that inhibit both their and especially women's and girls' access to reproductive health and family planning. We know that policy is an essential lever for expanding demand for and access to family planning. However, there's a dearth of literature about effective policy approaches to engage to involve engagement of men and boys as contraceptive users, as supportive partners for family planning, and as agents of change. There's much more literature on program interventions, but there's not as much on policy approaches. So to strengthen policy approaches to engage men and boys in family planning, HP Plus developed a policy framework for male engagement. And Beth will now tell you more about this framework. In Nepal, we use the framework as an analytical tool to help uncover strengths and gaps in the policy environment for male engagement and family planning, and then utilize the results to support local stakeholders to advocate for improved policies and programs.
So what you see on this slide is the outline of the framework with the main categories. And we'll put a link in the chat so you can access and review the full framework, which has quite a bit of detail. So the male engagement framework is organized around men's and boys' 3 overlapping roles, which Stephanie covered earlier. It includes 27 policy provisions that influence their participation in family planning and 7 principles. It's not expected that a single policy will encompass all the provisions found in the framework. Rather, the framework describes what a supportive policy environment looks like, and it shows the range of actions that can be incorporated into a set of policies to create that environment. So under each category, we've outlined what policy actions will create the supportive environment for male engagement. So for example, policies that engage men and boys as family planning clients aim to create an environment that provides them with accessible, male-friendly services and information, which could include policy actions such as to build the capacity of healthcare workers to provide these services, actions to reach men with services and messages at places where they meet, and ensuring that health insurance schemes cover all methods, including vasectomy. And then there are 7 principles, which are cross-cutting themes that should be integrated into all provisions, all policies. For example, the principle do no harm aims to meet men's needs while respecting women's autonomy. Positive engagement directs programs to involve men from a positive perspective rather than viewing men as the problem. And reproductive empowerment recognizes that men's ability to choose whether to have children, when to have children, how many children to have, has long-term impacts on their lives too. So the framework can be used as a resource for policymakers to design policies that support male engagement, and it can also be used as a policy analysis tool to identify strengths and gaps in global and national and local policy environments. So under HP Plus, we use the framework to conduct a global policy analysis of national family planning policies from 26 USAID family planning priority countries. And we also conducted in-depth assessments in 2 countries, Nepal and Bangladesh. So I'll hand it over to Erin now to give you more information about the Nepal assessment.
Stephanie mentioned already that we used the framework as an analytical tool in Nepal. And what we did as we conducted a text analysis of Nepal's national and subnational policies to identify barriers and opportunities for male engagement in family planning. And then we supplemented this text analysis with key informant interviews to understand stakeholders' understanding and perception of male engagement within the policies themselves, and then to understand how the policies have actually been implemented or not thus far. So at a very high level, we don't have time to get in depth, but we found that the policies really don't comprehensively address all 3 roles for men and boys in family planning. The biggest gaps were found around supporting men as supportive partners and as agents of change. And then the policies also missed a number of the principles that Beth just described, including do no harm, positive engagement, and reproductive empowerment. The key informant interviews were really interesting, and they showcased that there's really a gap in how policies are translated into programs and budgets. And this was really shown at the provincial and Palika level. Even though the national policies do have some provisions for male engagement in family planning, there was very little programs at the Palika level and almost no funds allocated for male engagement activities. So once we actually collected all of this information, we actually started working with local advocates to strengthen the male engagement environment in Nepal. So we held a virtual workshop in the beginning of December where 18 participants came together to assess the work that we already had and ground truth it with their own experiences. And then they used those results to develop a joint advocacy action plan. And given their experience and expertise, the participants decided they really wanted to focus their advocacy around increasing family planning information and services for adolescent boys. And they focused in 2 provinces, Karnali and Madhya provinces. We found that their advocacy actually comes at a really great time because the Palikas and the provinces are currently working on their annual budgets and activity plans. So they've been able to meet a number of individuals and stakeholders that are working on those plans and budgets in both provinces. And they've already started to receive verbal commitments to increase both budget and incorporate specific male engagement activities into those plans. So I think I'm pretty much out of time. I know that was high level. But I'll stop there, and I guess I'll open it up for any questions or if you want clarifications or more details on any of the pieces.
So please feel free to raise your hand or just turn on your mic and ask your question or any comments, or you can also put it in the chat. And if there are no questions, we have a couple questions for you all. So one is, after hearing about this this framework and how it was applied under HP Plus. Could you apply this framework in your work or programs? How? How do you envision doing that? And what adaptations would be needed?
Yeah. Sorry, I just want to ask. So I think for context, I am a 20-something male in Indonesia, and here it is mandatory for men before they get married to have a course on family planning. But I think there is still a lot of stigmas in in males when they take that course. They don't think that the course is actually important. So what I want to ask is in your experience in Nepal, is there any kind of similar stigma, and how to combat such stigmas so that there can be more male engagement in family planning? Thank you.
Excellent question. And Aaron and Stephanie, based on the analysis or the work that you've done with the advocates, did this come up, and any insights to share?
Sure, I can start and Stephanie can jump in if you want. So yes, this is a really important question, and it is something that has come up in Nepal as well. I think, we have seen in a number of different countries, including Nepal, that there is still stigma among adolescent boys and men in accessing services. A lot of times, family planning is still seen as a women's prerogative. And in Nepal, one of the things that has really been discussed is the importance of comprehensive sexual education from a young age, to really start engaging adolescent boys or younger boys early on, and to do some of those gender norm pieces with them to broaden their perspective around family planning from a young age. Stephanie, do you want to add anything to that?
Yeah, I mean, just echoing that, this is a prevalent issue in a variety of contexts. And, CSE is a great first step to sort of dismantling some of those ideas that, family planning is strictly a women's issue. And I know, just from the literature, some of the approaches that have been effective previously is, framing it in terms of overall health, both for the male partner as well as the female partner and the family in general. It's that family planning is about individuals' health, but also the health of the family. And so that's one way to combat some of the stigma. But I think increasing people's awareness from a young age, and especially changing some of the gender norms that make people believe it's family planning is just a women's issue, is a good way to end the stigma and prevent it from increasing. That's a great question.
Okay, thank you. The explanations, really great job, guys.
Thank you. And such a great question. We appreciate it.
Yeah, thanks so much. So I think we're at time. So thanks everyone for joining.